Hi students, this is Dr. Narrow. The purpose of this podcast is to go over a few important points about your APPEs before you get started. And I can't believe that it's going to be the 14th of May. In addition to this information, you'll be receiving some information from Ms. McCullough, and we would like for you to review this and also review her information. And if you want to come to one of the question and answer sessions on the 27th, please do. As I mentioned earlier, it is not mandatory, but if you would like to, please do come. And of course, anytime you have any questions, please feel free to contact me or Ms. McCullough about experientials and scheduling, and Ms. Click about filling out paperwork. And there's also information about filling out paperwork on the eValue webpage on your home page. So please access that. Your experiential manual will always be uploaded on your home page as well. And the points that I'm going to be bringing out in this podcast I'm just hitting the high notes. So you are responsible for reviewing the experiential program manual in its entirety before you get started. So just a few points about the APPEs. Let's talk about attendance. So attendance is mandatory. You have 2 days during any one block for illnesses. More than that time, if you are very ill, you may need to get a temporary leave of absence for that particular experiential, and you would receive it incomplete in that. There are other absences like family medical leave. You will need to talk with student affairs about that. Professional meetings. You have 3 days for professional meetings that you would need to make up. You'd have to work with your preceptor on that. And for residency or job interviews, you have 4 days in a block. 2 of those days you need to make up, and that also you'll need to work with your preceptor about when to make that time up. And with tardiness, you get 1 tardy, but your second tardy, you'll get 2.5 points taken off. And if you have a third tardy, you get 5 points taken off, and so on. So it's possible that if you have more than 5 tardies, you may receive a failing grade for that particular experiential. Communication, and that is per our catalog. The official communication will be done by Sanford email. You are not to use your personal email when you're contacting us or anybody else in the School of Pharmacy or at Sanford University. So always use proper etiquette and form and grammar when you are sending emails. They are a reflection of your professionalism. So for academics, you must receive a 70% or greater on the PCAP or our evaluation tool. These are the objectives. There are 10 objectives that the preceptor will assess you on. And that's independent of your grade if they choose to give you a final exam or if they choose to give you a project. So for example, if you made a 65 but you made 100 on your project or a 100 on your final exam or a very high grade, and it did bring you above a 70, you still would not pass your experiential because you have to have a 70% on the objectives. And a preceptor can count 60% of your grade as the objectives, but it can also count 100% of your grade if the preceptor chooses not to have a project or not to have a final exam. And it's pretty rare when a preceptor does not want to give you something extra, for example, a project. A failing grade in an APPE must be repeated, but it cannot be repeated right after you've taken it, and you do not get the same preceptor. So for example, if you take PHRX 601 and you failed it in block 1, you're not eligible to take that again until block 3, and you will have a different preceptor. And all preceptors and faculty are required to assess you at midpoint. And if it comes midpoint and you don't get an assessment, please remind your preceptor. Or if you don't get one after week 3, then please contact me, because this only benefits you and it also benefits the preceptor. You can receive an incomplete for an illness or an emergency, but you must have a passing grade in order to stop out. So if you fail in the same experiential twice, then that means that you are expelled from the School of Pharmacy. So low scores. If a student receives a low score, which means that they do not receive a meets expectation on any particular objective, then I will receive a report immediately. As soon as that preceptor hits submit, I will receive that report. So at that point, I will contact the preceptor and ask what the plan of action is. And sometimes the preceptor will say that they've got a plan of action for the rest of the experiential. Sometimes the preceptor will want me to talk to the student at that point. So there will be a plan of action put in place to progress, and then I record all low scores in eValue. And in addition, when you are assessing a preceptor or site, if you give that preceptor or site a 2 or lower, then a low score report will be automatically generated to me, and I will be able to record that and make note of that. But just remember that your preceptor will not see your evaluation of him or her until after you graduate. So please be candid. Please use constructive criticism. But don't worry that right after you leave that experiential, or that you will get that preceptor will see your evaluation of them. They will get a aggregate, and they won't know who has scored a student. Who has scored a preceptor a particular way. They will see comments, and unless you put something that talks about the particular block that you're in, or says something very specific about yourself, they will not be able to tell who the comment came from. The comments are all mixed up when they get the aggregate. So they will not receive any of the evaluations until after you graduate, and they will not be able to tell who has written a particular comment. They are anonymous. Students are expected to review and abide by the McWhorter School of Pharmacy Code of Ethics. And we also have an assessment within the assessment tool, which is entitled Values, Attitudes, Behaviors, and Relationships. So if a student receives a does not meet expectations in any area under that section, then 10 points will be deducted off of the final grade. And always remember that you do not falsify any documents because that could be a values violation. Drug screens. So drug screens are done differently during your 4th year. You will receive an email from ESS in the morning that you're going to have the screen, and you have 2 days to be screened. So you will not come on campus like you did as a 1st year, 2nd year, or 3rd year. You will receive an email first thing in the morning, and for example, if you get an email on Monday, you are required to be screened by Monday, by that afternoon, or by Tuesday afternoon. And you will not, you need to be there by 4:30 because they usually close. So you get 2 days in order to get that screening done. And this email will give you a link to find out where the nearest LabCorp is. You can always go to ESS if you are in Birmingham, but many of you may be out of the metropolitan statistical area. So when you get the email, it will have a link. You click on it, you put in your zip code, and it will tell you the closest place to go to get your testing done. Please follow all the directions on the email and bring that email with you when you go to the screening. So if you are at a national meeting or state meeting, you will be excused from getting tested. If you are out of the country on an international, you'll be excused. If you're in the hospital or if you are severely ill, you'll be excused. But you will not be excused if you're on your off block and you just happen to get called, or if you are pregnant, you might get called as well. But please know that we have nothing to do with the randomization. This is done by ESS, Employment Screening Services. They are the ones that randomize this. So we follow what they have randomized. Now, some of your sites might also want to do a screening according to their rules and regulations. You are assigned to one preceptor instructor of record at the site, but he or she may have others at the site that want to work with you. So it might be another pharmacist, a physician, a medical or pharmacy resident, or other healthcare professional may have input on your evaluation. So please always act appropriately in the interprofessional setting and abide by all the rules and regulations of that setting, that facility, and the state that you're in. So, Sanford Housing. Sanford owns the Holly House in Marion, Alabama. Those of you doing it in experiential will probably be staying in the Holly House if you're doing an experiential in Perry County with Dr. Murphy. So all the rules and regulations of Sanford University and on-campus living apply to the Holly House. So it is the responsibility of the student to keep it clean, take out the garbage, keep it orderly. There is not maid service while you're there. And this also applies to international housing. It does not belong to Sanford, but some of your preceptors require that you stay in particular housing. So just make sure that you keep the area clean and you abide by all the rules that they have in the international housing. So all of this information can be is provided in the experiential manual. It is uploaded to eValue on your home page, and you are responsible for reviewing all of this. If you have any questions, please do not hesitate to contact me or Ms. McCullough or Ms. Click about any needs that you have, and we will be happy to talk to you on the 27th if you want to come. If not, then I hope to see you soon, and just come contact me by email if you need to see me. Then we can make an appointment. See you soon. Thanks.